Hello, everyone. Welcome to this audio podcast. Today, looking at this audio podcast today will be looking at aspects pertaining to chronic kidney disease, CKD, and aligned to and sort of an interlink with aspects pertaining to red cell blood transfusion practices or RBTs. This audio podcast today looking in this audio podcast as part of the series the Strappen Investigate. This audio podcast as part of the Convoy. This audio podcast as part of the Shitstorm Squadron. This audio podcast as part of a Storm Robotics production. So, healthcare service users with chronic kidney disease or CKD, much like a more intricate conditions or healthcare conditions that are pertaining to a sort of hematological underpinnings, for example, suffer sort of simultaneously from multiple symptoms or symptomologies related to the conditions and or side effects of sort of particular sort of medical treatments, RBTs or red blood cell transfusion. Red cell blood transfusion is again is a form of treatment in including. So these clusters of symptoms or clusters of symptomologies may exert an adverse effect not only on sort of physical aspects pertaining to physical health, but also on sort of on aspects pertaining to other sort of as part of other sort of pathophysiologies, including aspects pertaining to aligned to well-being or wellness, and thus giving rise to what is described in amongst various literature as symptom burden. So for example, whilst red blood cell transfusion or RBTs now in context of varying sort of varying forms of in aligned to different or varying health conditions, where for example there can be one of the main symptoms or symptomologies consistent in healthcare service users, for example, can be anemia or low hemoglobin, for example. Um, so is where RBTs originally sort of historically in some cases had been the principal therapy or treatments in recipients who may be known to have sort of conditions or health conditions that have sort of a low hemoglobin or anemia at sort of default, but additionally, in patients who may be known to have renal insufficiency to treat anemia or low hemoglobin, where this have become where in amongst sort of some practices, healthcare practices have become predominant. However, with renal function decline, or renal insufficiency, this has an impact on overall treatment and care plans. Patients are then potentially also becoming untransfusable. In as part of a previous or audio podcast, listeners and viewers, there is some sort of elaboration in amongst aspects around chronic illnesses and untransfusable inexcusable healthcare service users or patients, and so to iterate, listeners and viewers are welcome to check out that particular audio podcast in as part of the Ztorm Robotics audio podcast works. So having a good sort of knowledge base is generally important or critical for laboratory practitioners, laboratory practitioners and specialist scientists. For example, also bearing in mind there are now more sort of restraints or constraints in context in context of red blood cell transfusion practices since some of the guidelines since some of the guidelines in amongst red blood cell transfusion practices sort of vary between different regions and different sort of laboratory environs, for example. At the same time, recent evidence has emerged that a more restrictive red blood cell transfusions practice is safe and tends to avert the potential harms associated with more liberal transfusion strategies. So historically, so for example, to iterate listeners and viewers, is that historically the or some of the guidance in around red blood cell transfusion practices used to be where, for example, if there was a hemoglobin, for example, that was above or slightly above the sort of normal sort of threshold of what would be determined as low hemoglobin or anemia, then historically in some practices, in laboratory practices, that if frontline healthcare professionals requested blood as red cells, for example, as backup in case healthcare service users or patients do have a drop in low hemoglobin, or where their anemia sort of can become more compromised, for example, then it is where laboratory practitioners would fulfill requests in around hemoglobin would fulfill requests in around red cells requirement in amongst and from frontline healthcare professionals. But guidances in around red blood cell transfusion practices have differed, as per said. So whilst there have been some aspects of restrictive practices in around red blood cell transfusion, this has prompted sort of safe sort of practices, and sort of also averts the potential harm associated with more liberal transfusion strategies. At the same time, now there should be sort of more of a scope to integrate the use of what's referred to in sort of amongst literature as patient-reported outcome measures to help support the development or co-development of future practices, also where future practices align to aspects pertaining to patient and public involvement, or PPI, and sort of support and develop prospective scientists or health scientists, leaders and managers, thus bridging and bringing biomedical practices more to the forefront, or more interlinked with frontline practices or frontline clinical practices. That draws this audio podcast to a close. This audio podcast as part of the Strappen Investigate, this audio podcast as part of the Convoy, this audio podcast as part of this Shitstorm Squadron, and this audio podcast as part of a Ztorm Robotics production.